Good afternoon, students. My name is Dr. R.R.THANIGHARASU. I am from Clinical Laboratory Technology. Today, I am going to present about a new staining technique called acid-fast staining technique. Acid-fast staining technique, it says about the most deadly pathogenic bacteria called as Mycobacterium tuberculosis. This Mycobacterium tuberculosis bacteria, they surrounds in the environment in the air. So we call it as a aerosol. This Mycobacterium tuberculosis bacteria, they cause TB infection in the human body. So this bacteria, Mycobacterium tuberculosis, can affect any person at any time. So it is resemble like a coronavirus. This Mycobacterium tuberculosis is the only bacteria that surrounds in the environment which is more dangerous to the human environment. So let me say about this bacteria, how it is able to be identified in the microbiology laboratory. That staining technique is called as acid-fast staining technique. This acid-fast staining technique is done only in the microbiology laboratory. So let me say how this staining technique is done in the microbiology laboratory. First, aim to identify the pathogenic gram-positive bacteria Mycobacterium tuberculosis by Zeil-Nielsen acid-fast staining method. Okay, by using this Zeil-Nielsen acid-fast staining method, we can identify this most dangerous deadly pathogenic bacteria Mycobacterium tuberculosis. Okay, this is the aim. Our aim is to identify the pathogenic bacteria Mycobacterium tuberculosis by Zeil-Nielsen acid-fast staining technique. So let me explain about this staining technique in detail in the principle. First, our aim is completed. Next, our principle. Acid-fast staining technique require special type of staining because this bacteria, Mycobacterium tuberculosis bacteria, has a strong mycolic acid in the cell wall. It is very strong. So by using special staining reagents, we can able to see the pathogenic bacteria in the light microscope. By using light microscope, we can see this deadly pathogenic bacteria, Mycobacterium tuberculosis. This technique is identified by the scientist Zeil-Nielsen. That's what we have mentioned about Zeil-Nielsen acid-fast staining. This technique is identified by the scientist Zeil-Nielsen. So we call it as Zeil-Nielsen acid-fast technique. So our aim and the principle is completed. So let us move to the materials required. What are all the materials needed to done this test in the microbiology laboratory? First, inoculation loop. Next, light microscope. The bacterial culture, we can see it in a glass plate. Okay, and then a small glass slide, and then glass beaker with water. Next, tripod, and then next wire gauze, and then next Bunsen burner. Next, 1% saline, glass marker pen, soft tissue paper, and these are the special reagent. Last three: acid alcohol carbol fusion, grams decolorizer, methylene blue. So these much of reagents is needed to do this Zeil-Nielsen acid-fast technique. So let me count about this procedure. How we are going to do about this technique procedure. First clean the glass slide with tap water. Glass slide means we can see the glass is a rectangle shape, small size. Okay. First clean the glass slide with tap water. Then clean the glass slide with soft tissue paper allowed to dry. Take a soft tissue paper and clean the glass slide which has water droplet in it. So clean a soft tissue paper, then it become dry. Make a oval shape at the center of the glass slide by using glass marker pen. At the center of the glass slide, you have to make a round oval shape by using glass marker pen. Okay. Next time. Incineration means heating. Incinerate the inoculation loop. Loop means you can see it, for example, you can resemble like a spoon. So incineration means heat the inoculation loop in a Bunsen burner and allow it to cool it for 2 minutes. So after 2 minute cooling process, add 1 drop of saline in a bottle. 1 drop of saline means 100 gram of sodium chloride in 1 liter of water. If you add 100 grams of salt, 100 grams of salt or NaCl, if you add 100 gram of salt in 1 liter of distilled water, it is called as 1% saline. So from that saline, after cooling process, you have to take 1 drop and then once again place 2 minutes and place 1 drop of saline at center of the glass slide. So after 2 minutes process, place 1 drop of saline at the center of the glass slide. Okay, and then once again insert the inoculation tube using Bunsen burner, cool it for 2 minutes, then smear the bacterial, that is the deadly pathogenic bacteria, Microbiome tuberculosis culture on the glass slide. So after adding 1 drop of saline, you have to once again heat and cool it for 2 minutes. Then you have to stick the culture. Then only you will get this as a even and beautiful smear. So if you smear without the saline, you won't get a proper culture. So first you have to add 1 drop of saline, and above the saline you have to smear the culture. Then you will get even and beautiful smear. Okay, let me go for the next line. On the Bunsen burner, place a tripod. It will look like a triangle shape. 3 bars. It will look a triangle shape. So on the Bunsen burner, place the tripod. Above that, keep the wire gas. It will be like a stainless steel wire gas. And then glass beaker with water. Open the flame with Bunsen burner. Allow the heat. On the wire gas, you place the glass beaker with water, and then you start to heat the Bunsen burner. So water with the glass beaker will started to heat. Then when the water started to get boil, place the glass slide bacterial culture on the top of the beaker. If it is the glass beaker, you have to place the glass slide with the culture on the top. This is the procedure. Then after placing on it, then add acid alcohol carbonyl fusion completely on the glass slide. You have to add that is a reagent called acid alcohol carbonyl fusion. You have to add it. You have to make as a it will be look like a pond, small pond. For example, it resembles like a pond. So you have to pour the reagent complete on it. It resembles like a pond. Okay, just a resemblance. Okay, so you have to add the carbonyl fusion reagent completely on the bacterial culture. Okay, this is the first reagent. Let us go for the second reagent. Next slide. The flames will start to come from the heat after 5 to 7 minutes. Stop the heating process. Wash it with tap process. So when you add acid alcohol carbonyl fusion, the water start to get boiled. So after 5 to 7 minutes, the flames will start to come. You can see like a reddish flame. So after then, when the flames started to stop the heating process immediately, and then wash it with tap water. This is the first reagent procedure. The second reagent procedure. Then add grams decolorizer, which is a reagent. This is used for washing the mycolic acid, which is a strong acid present in the cell wall of the gram-positive bacteria, Microbiome tuberculosis. Add grams decolorizer for 1 minute. If you add 1 minute, then only this mycolic acid will completely 90% will be demolished. So okay, since it is very strong, add grams decolorizer for 1 minute on culture, then wash it with tap water. So this process goes. The third reagent. Finally, add methylene blue for 2 minutes and strain it. Once again, wash it with tap water. Then remove the water droplets at the bottom part of glass slide using soft tissue paper. So when you add tap water, the reagent and the water droplet will be present in the glass slide. So take a soft tissue paper, clean the bottom part of the glass slide using soft tissue. Then that portion will become dry. Observe the bacterial culture in the light microscope using 45 subjective. Microscope we can know, everyone know. So if you have to place the glass slide at the center part of the microscope. So when you see in 45x, you can see the bacterial culture in the light microscope 45x. There are different sizes are there, 4x, 45x, and then 100x. Okay. Observe the bacterial culture in the light microscope using 45x. When you are seeing the bacterial culture in 45x objective, the size will be little bit small. So, if you want to see for bigger size, there is another option. Add cedar wood oil, 1 or 2 drops. You have to move the stage, and then you have to add one or two drops of cedar wood oil on the glass slide present in the microscope. Move the 100x objective. By using 45x objective, you can see the bacteria in a small size. But when you move for 100x objective, so you have to move the 100x objective to the glass slide, fix it, fix the bacterial culture. We can see bigger size of bacteria. When you go for 45x objective, the size of the bacteria will be very small, little bit small. But when you go for 100x objective, the size of the bacteria will be bigger. It will be more comfortable for the patient to take the result. So, if you want a bacterial culture, that is a sputum culture, that if you want a microbacterium tuberculosis, what is the procedure means? The patient has to come to the laboratory early morning, 6:15 to 6:30 a.m. So he has to come to the laboratory without brushing. So you have to they will give a plastic small container. He has to split the saliva in that. By using that, we have to we can see the staining technique. Thank you, students.